Hello. Today we are going to learn about dispensing process. Basically, what do you do when you receive prescriptions from a practitioner? My name is Ibrahim Abdullah from School of Pharmacy, Management and Science University. This is a sample of prescription that normally we receive. We have the patient particular, MRI number, OPD award, medication order, pharmacy, where pharmacy will fill up all this quantity supplied as well as the price, and the doctor's particular, including the signature, dates, etc. Okay, what is the first step? First step is screening. When you receive a prescription, you have to screen for the prescription whether the prescription is valid, whether the prescription comes from the doctor itself, for instance, or not, and then you have to check whether the date is there, whether the prescription is complete or not. So you've got to check all the patient particulars are filled up, all these boxes are filled up, this one is also filled up, and as well as these ones. So of particular importance is the signature of doctors, name and address of the doctor, as well as the date of prescription, because some prescriptions are valid only for certain time only. Step number 2, calculating. You have to do the calculations of the ingredients required. Give you examples here: pantoprazole 40 milligrams OD for 2 weeks. So you have to calculate how many pantoprazole tablets you need to give out to the patients. In order to do that, you have to know all the abbreviations. You have to know what is the meaning of OD, what is the meaning of TDS, PRN, BD, etc., etc. Step number 3. You have to prepare the labels, proper labels. You have to choose the proper labels. You have to identify whether the preparations that you are giving out to whoever is taking it is for stock or for patients. Whether you want to use black or red labels, and the most important label that you must not miss out is keep out of reach of the children. There are two main labels, as you know: the main labels and the auxiliary label. Auxiliary label is like additional labels. For instance, do not drive when you are taking these medicines because the medicine can cause drowsiness, etc. Step number 4, packaging. You have to start packaging once you finish with the labeling, once you finish with calculating. You have to identify whether you want to use zipper bag, whether you want to use container, and what sort of container you are going to use, whether you want to use amber container, you want to use clear container, depending on the type of medicines that you are giving out to patients. Nowadays, the government is trying to phase out the bulk liquids and loose tablets for a lot of reasons, like hygienic reasons, for instance. Therefore, you are not going to have all these types of loose tablets anymore. Instead, they will come in blister pack like this. Similarly, liquid, you don't have any gallons preparations anymore. They all come in smaller packaging like 60 ml, 100 ml, etc. That is that are easy to give out to patients. Step number 5, you have to double check your friend's work or your friend is checking your work. This is to prevent unintentional or probably intentional errors that may occur during the process. And finally, of course, dispensing the medicines to the patients or dispensing the drugs to whoever is taking the medicines. You have to give proper drug consultations, especially to patients. That is part of a pharmacist's job, and please remember, we give free consultations to patients. Do not ever charge patients. If you have any question on those processes, you can send me an email at that email address over there. I'm glad to answer those questions.